the title of the paper that we are talking of here is Agmatine attenuates chronic unpredictable mild stress induced behavior alteration in mice. This was a paper that was published in European Journal of Pharmacology, and the content of the talk would be, I'll be first briefing about the article information, the abstract, introduction, material and method, result and the discussion. So this is a screenshot of the paper that is expected to be in the journal club presentations. As you can see, this is a European Journal of Pharmacology, and at the top we have the issue number and the year and the page number. This specializes in behavioral pharmacology, this specific article, and the cross mark is to look out for this article because it is comparatively newer. So we have the authors enlisted here, where I would want to tell you that this was my and Dharmesh Faldu's thesis work, and Jay Sakaria was our junior who had helped into the drafting, and Taksande sir as my guide, and all the other people who have helped in the drafting. So you can see here that there is article information also. We had submitted this on 2nd May 2013. We had and then we got a revision, small points. Then we submitted it on 19th October. It was accepted on 23rd October, and 29th October it is available online. Okay, the keywords here are Agmatine, depression, anhedonia, CUMS, splash test, and FST. Also taking into consideration further why I have selected this paper, because selection of paper is important, is if you can see, this is my highest cited paper. It has been cited by 37 people since 2013. So point here is that we want you to select a paper that is of good quality. Please understand that don't select any paper that is not of high quality. Okay. So coming to the abstract, we are talking here roughly, I'll tell you quickly what we are talking about. We are talking of a procedure called CUMS, which is chronic unpredictable mild stress. So stress is applied to the animal chronically, and mild stress is applied, which would lead to development of some disorders or some behavioral changes. And that happens to everybody of us. If you are in mild stress for a long period of time, there may be some changes in your behavior over the period of time. Our molecule of interest in pharmacology, if you all know, is agmatine. That is a putative neurotransmitter. Putative means it is a neurotransmitter that is being thought of and into discovery. So like GABA and glutamate, it's not like that. It is a neurotransmitter that is still into discovery. And we propose that agmatine will be able to tackle stress-induced depression. I hope everybody can understand what is stress-induced depression. Okay. So in the abstract, we have that agmatine is released to various stressful stimuli, and it is required to maintain homeostasis. Present study investigated the role of agmatine on CUMS-induced behavioral and biochemical alteration. CUMS protocol for 28 days was taken up, and it caused diminished performance in sucrose preference test. I'll be explaining later what are these tests. Splash test, force swim test, and marked elevation in plasma corticosterone levels. So if you know, corticosterone is a marker of stress. Whenever you are in stress, your blood cortisol in humans, steron in rats and mice would be increased. Then chronic agmatine, 5 mg per kg and 10 mg per kg IP, normalized the above parameters. So whatever is happening because of stress was normalized, and it also prevented the body weight changes. Now, development of drug based on brain agmatinergic modulation is a new potential approach that we are thinking of for the depression, for the target of depression. So the first part of any paper, as you know, is introduction. So into the introduction, we are seeing that chronic stress and the resulting dysregulation of the hypothalamic pituitary adrenal axis, HPA axis, that includes the hypothalamus, pituitary gland and the adrenal gland, enhance vulnerability to various neurological disorders. So you have been into stress for a long period of time, your vulnerability for such disorders, neurological disorders is increased. Now, several neurotransmitters and neuromodulators and their interaction in CNS regulate response to stress. Originally, it is modulated by various neurotransmitters and neuromodulators. However, the exact mechanism behind the deleterious effect of chronic stress exposure is not known fully or is yet to be elucidated. So, stress always has adaptation along with it, and then long-term stress, how does it causes damage, etc., is not known fully. So agmatine, a biogenic amine, it is an amine by nature and a putative transmitter, has been implicated in the stress response and related disorders. This we know. Now, what is agmatine? It is a putative neurotransmitter again, that is biosynthesized from L-arginine. L-arginine is the precursor, stored in the synaptic vesicle, accumulated by uptake, reuptake process of neurotransmitter, released by depolarization. So a signal would come and release it, inactivated by agmatinase. Agmatinase is a specific enzyme system that is required for breaking of agmatine, metabolized to putrescine gonadinobutanoic acid by enzyme agmatinase and diamine oxidase respectively, and it interacts with alpha 2 adrenergic imidazoline agents NMDA receptor and causes nitric oxide synthase inhibitory activity in brain. Now the above four criteria that we are talking of, because I am telling you that agmatine is a molecule that is a neurotransmitter into investigation, it is necessary to understand that does it follow the criteria of a normal neurotransmitter. Tomorrow I'll be taking up any chemical compound X, let us say, from the brain and claiming it that it is a neurotransmitter would not be right. I will have to prove, and there are certain rules for any neurotransmitter to be called so. What are those rules? It should be biosynthesized from something. L-arginine is the precursor. It is an amino acid. It should be stored in the synaptic vesicle, that agmatine is doing. It should have a reuptake mechanism. So if it is present in between two neurons, it should be reuptaken. It should be released only upon depolarization. That means some signal would be coming and causing the release of it. Inactivated by an enzyme. So any neurotransmitter system should have its own enzyme system for the inactivation, and it should have its metabolite. So this is a compound that follows the normal criteria that is given for any substance to be called as a neurotransmitter. And apart from that, the special thing about agmatine is it has a multi-ligand affinity. So it can go and sit on alpha 2 adrenergic receptor, imidazoline receptors, NMDA receptor, and nitric oxide synthase inhibitory activity also. So I hope everybody is clear with receptors in their degree background. So now why we chose this, or what are the earlier evidences of agmatine is exogenous agmatine has exhibited several intriguing neurally relevant functions. What are those functions? Exogenous agmatine has reduced the neuronal injury produced by focal ischemia, spinal cord injury, hypoxic ischemia. Exogenous agmatine itself is known to cause anxiolytic effect, which means it will decrease anxiety, antidepressant effect, it will reduce depression, it will reduce the pain, anti-nociceptive is in regards to pain, and it has an anti-convulsant effect, anti-inflammatory effect, anti-proliferative effect, and neuroprotective effect. It has been also known in the management of several chronic pain syndromes. So exogenous agmatine, which means agmatine that has been given externally, has been known to produce these effects, which means it is a substance that is quite useful and has potential therapeutic importance. Now, in the involvement of stress, if we see, so there are certain stressful pathological conditions like inflammation because of stress, ischemia is lack of oxygen because of stress, and LPS injection has known to cause increased agmatine levels. Then exogenous agmatine, again externally administered agmatine, has repeated attenuated, which means decreased the repeated immobilization induced corticosterone levels, which means if you immobilize a rat for a long period of time, the rat would be obviously into stress and there would be increased elevated corticosterone levels in the rat and glutamate efflux. Glutamate is an excitatory neurotransmitter. So when you give agmatine in such a condition, then the elevated corticosterone level is attenuated means decreased, and glutamate efflux is also attenuated. The neuroprotective effects against cell damage. This is an in vivo experiment. In vivo, I hope everybody understands, is in live animal. This is a cell line experiment, the third example that I'm talking of. Neuroprotective effects against cell damage caused by glucocorticoids and glutamate in primary neuronal cultures of the hippocampus. So hippocampus is an area of brain that is responsible for against stress management, etc. So when the neurons of hippocampus were cultured, it was found out that agmatine is neuroprotective against the glucocorticoids and glutamate. Several nuclei of hypothalamus and pituitary gland have shown abundant agmatine immunoreactivity and co-localization with neuropeptides. Again, why are we interested in these two regions? Is because we are talking of the HPA axis in stress. So pituitary gland is our area of interest, and hypothalamus generally holds the vegetative control of many functions. So in these two nuclei, agmatine has been tremendously co-localized with other neuropeptides, which means it has some role in the management. Endogenous levels of agmatine increase during stressful conditions. So it has been also observed that if you see any stressful conditions and measure the endogenous level, you will find that there is a rise in the agmatine level. So what is postulated that agmatine is one element of self-protection mechanism in the brain, and this may be triggered. So when you are in stress, agmatine synthesis may be triggered as a self-protection mechanism. The effect of exogenous agmatine on stress-induced depression and related behavioral alteration remain unexplored. So it has not been properly explored how exogenous agmatine would be dealing with the stress-induced depression. Again, I have earlier in my presentation talked about antidepressant, but depression may be because of many reasons. Here we are chiefly focusing on stress-induced depression. So if you are into stress and the consequence of it is depression, then how exogenous agmatine can help was not explored. So we are primarily doing that. So what were the material and methods? In any paper, you will be seeing this as a section. So subjects, we have taken adult Swiss albino mice of either sex weighing 25 to 30. So we have taken male as well as female animals. They were maintained on 12-12 hour light dark cycle, lights on at 7 a.m. and off at 19, which means 7 p.m. So the cycle was normal, that runs as in day. We have not reversed it anyways. Food and water were provided ad libitum. Ad libitum is free access, except during specific experimental protocols. So in the causing of stress, CUMS, at that time, sometime we were not giving water to the animal as a stress. So except that, food and water was given freely to the animal. All experimental procedures were carried out under strict compliance with IAEC, Institutional Ethics Committee, under the guidelines of CPCAC. So anybody would be wanting to do a practical on animals will have to take this first. Now material and methods again. The second point is what was the drugs taken and how were they administered. So we have taken agmatine sulfate as our drug of investigation. It was procured from Sigma Aldrich, USA. Fluoxetine, it was received as a gift sample from Sun Pharma, Baroda, and both the drugs were dissolved in saline just before the experiments, because by doing that we nullify the possibility of solution degradation, and administered intraperitoneally. So intraperitoneal, again, I believe in third year and final year you must have seen what is intraperitoneal administration. Normal saline was used as a control. So in the control animal, we did not give anything, we just gave normal saline. Now, how was this chronic unpredictable mild stress applied? 2.3 point is, it is henceforth we'll be calling it as CUMS. This was designed to maximize the unpredictable nature of the stress. So again, I am not here talking of some format of stress that you know you are going to deal with daily. So we are working more towards the unpredictable nature of stressor. Let us take an example like what soldiers would be facing. So sometimes there is weather as a issue, sometimes there is food as a issue, anything. So our stress is unpredictable in nature. what did we do to apply this stress to animal? Restraint stress means the animal was restrained into a restrainer. Continuous overnight lighting. So the entire night they were with lights on. You can understand this can be a mild stress for somebody who wants to sleep. There was tail pinch as a stress. Shaker stress is where the cage was put on a shaker. So unnecessarily movement. Tilt cage. Imagine yourself, you are sitting for 3 hours with your chair angled at 30 degree. It could be stressful to your blood circulation, or overall it could be irritating. So tilt cage was one of our stressor. And overnight soiled cage, which means soiled means bad cage. So we were not cleaning the cage, and overnight we were keeping animal in soiled cage or uncleaned cage. And once this was all routinely not applied, it was planned 4 weeks, for 4 weeks in an unpredictable nature. Care was taken that the stress remains mild and is not very high. So because high level of stress can cause certain other things, and we wanted to focus on mild stress. Now, what were the group of animals we had taken? We had taken first group of 6 animals that were only given CUMS and were injected with saline. So only given CUMS, injected with saline, and checked what is their result. Then there was one group that was given fluoxetine. You know, fluoxetine is a standard antidepressant. So we wanted a positive control. So fluoxetine was taken as a positive control. Agmatine, as we have been talking, was our investigation molecule. It was taken in 3 doses, 2.5, 5, and 10. And as you can see, this is a geometric progression, double of the earlier dose. And it was administered from day 15. So 4 weeks is 28 days. And in 28 days, after the 14th day, from the 15th day to the 28th day, we every day gave agmatine or fluoxetine or saline to the different groups. And again, that was fixed to be given between 9 to 10 a.m. only. You cannot change the dosing frequency or time. Unstressed group, there was one group that was taken which was not given any stressor. It was just injected with saline and handled daily, and also not subjected to any stressor. This was done because we wanted to see what is the difference between unstressed, stressed with a known drug, and stressed with a drug that is of investigation. Now, what are the tests that we have taken up? First was called as a sucrose preference test. This was a test that was considered on day 0, 14, 21, and 28. As you can see, after every 7 days. Now, what is this test? Sucrose preference test. It is 72. It is a test where animal is given exposed to 2 bottles. It is also called as 2-bottle choice paradigm, where in one bottle you have just water, and in another bottle you have 1% sucrose solution. And animals or mice and rat would like to drink sweet water, 1% sucrose solution water. This indicates their well-being. If the animal is drinking more than 60% water of the sucrose water, then it is indicating that animal is okay to pleasures. But what will happen when you are giving CUMS? After giving CUMS, the animal won't be able to identify what is the difference between sweet water and what is the difference between normal water, and it will not drink the sweet water. So it is so stressed, the animal is so stressed that it is not understanding the difference. And earlier, sweet water, 1% sucrose water was pleasure for animal. Now it makes no difference. So the animal has given up kind of. What is the difference if you drink tap water or sweet water? So this sucrose preference was calculated as sucrose consumption upon water consumption plus sucrose consumption into 100. Mice showing basal sucrose preference less than 60% were considered anhedonic and not used in the study. So basal is, before starting the experiment, we have done a test, and at that test, if there was any mice that was showing a preference of less than 60%, it was already considered anhedonic. Anhedonic is lack of pleasure. So that mice was already considered as anhedonic and not taken into the study. Then next is splash test. This is again a very interesting test where what it does is it is considered to be a marker of grooming behavior or self motivation. Here what you do is animals were isolated in home cages for 24 hours and 10% sucrose solution was squirted on the dorsal coat. Means by a injection or by a syringe you put 10% sucrose solution on the mice. Now, what will the animal do? The animal will try to clean it in the normal condition. If I throw water on you, you will try to clean yourself. But in this case, what happens is animal is not interested to clean yourself itself. So it is called as the what self care and grooming frequency is a motivation, self motivation. So that was lost. So latency to initiate grooming, which means after you have put the water on the animal, in how much time it starts cleaning itself or grooming itself, as well as how many times frequency of grooming was recorded for 5 minutes. And we observed that in CUMS this parameter is not okay. So the animal is so stressed or depressed that it is not interested to take care of itself. Grooming behavior. Then force swim test. This is a 6-minute test session that is done in a plexiglass cylinder, gold standard for testing depression, where immobility time is measured by a trained observer. And please, like it has been constantly said, the observer are always blind to the treatment. They don't know which group is what they're doing. So a mouse was considered immobile when it remained floating motionless in the water, except making necessary movements. And the fourth thing that we are talking of is corticosterone level. So from the blood, we have checked the corticosterone level, retroorbital plexus, say blood Nicolai, and then the blood is stored at -20 degree, and through HPLC corticosterone level was checked. What is it? So again, I will be repeating that we were interested in making the animal stressed. For it, chronic unpredictable mild stress protocol was used. Sucrose preference test was done first as a marker of anhedonia. Splash test was done as a marker of self-care behavior. Force swim test was done as a marker of depression, immobility time, and corticosterone levels were done as a marker of HPA axis dysregulation. So if the stress is induced properly, the corticosterone levels would be slightly changed, or not slightly, it would be changed. And then the statistical analysis, the data were expressed as mean plus minus SEM. Please remember that we just cannot mention mean. We have to mention what is the standard error across the mean. The splash test, force swim test, open field test were analyzed by one-way ANOVA where only one parameter is involved. And sucrose preference and body weight is where two-way ANOVA was done. Two-way ANOVA is where we are talking of two variables, time as well as the dose, etc. Corticosterone levels were analyzed by the basic unpaired t-test, and result of statistical test with p significance value less than 0.05 were considered significant. Now, these are the results. So this graph may not be very clear, but I hope you have gone through the paper and you can understand this. So as you can see, this is a percent sucrose preference. Remember, I told you that any animal showing sucrose preference below 60% was not taken. So you can see all our animals are above 60%. Our data is starting bit above 60%. And then we have saline non-stress group. One group that I told was not stress, just taken up. Saline and a group that was given stress, fluoxetine as a known marker antidepressant, Agmatine 2.5, 5 and 10. So here you can see the saline over the period of time, saline that is non-stressed over the period of time is going up. It is enjoying sucrose, or for that matter, nothing has happened to this animal. As against the CUM, stressed animal, it is a square that we can follow down. So on the 0 day it was okay. On the 14th day it has fallen down. It is not interested into the sucrose. On the 21st day it has fallen down again. This dollar sign, if you can see, and on the 28th day it has fallen down like anything. This dollar is against the non-stressed animal. So you can see the animal is not interested into the sucrose solution. It is not preferring the sucrose solution, which means it is stressed and it is anhedonic. It has no pleasure in the sucrose solution right now. It is unable to identify between the normal water and the sucrose water. Give it anything, it does not. It is not understanding it. As against to it, on the 28th day, if you can see, the triangles are indicative of the agmatine. So agmatine 5 mg has been effective. It has been able to keep it above 60%. Agmatine 5 mg and 10 mg. Also 10 mg has been able to keep it above 50%. Fluoxetine is a known standard. It is known to increase or elevate your mood. So fluoxetine here also, that is depicted by a circle, is above 60%. Our drugs are also effective here starting from your 21st day. So this indicates that agmatine 5 mg and 10 mg were able to retain the sucrose preference. They were able to protect the animal from this behavior, and which was comparable to fluoxetine. So as good as a normal known antidepressant. These were the treatment days from 14 to 28. We have not given for the entire 28 days. We have started our treatment from the 14th day. Okay. And basal drinking behavior of the animal was also known. So it is known that agmatine does not overall increases drinking behavior. A separate study has been done in which it has been established that agmatine does not affects the drinking behavior as such, as in it is not an agent that will cause you to drink a lot of water. So this is effect that is purely because of the sucrose preference. It is not to be overlapped with agmatine's excessive drinking behavior, which is not in place only. Because I am telling specifically this because there may be some drug that may increase your water intake. So the drug may have some mechanism that increases your water intake, will make you more thirsty, will make you drink more water. And agmatine per se, which means on its own, does not have any such effect. So this effect is purely because of the sucrose preference. The second is the self-care thing that I talked of, splash test. Now here how we have it, we have grooming latency, which means as soon as you put that injection on the animal, in how much time it starts cleaning itself, and grooming frequency, how many times it will do this grooming. I hope everybody understands what is grooming. This is a behavior of the animal where it will be cleaning itself, or where it will be by its front paws, it will be scratching its head and other things. So here we can see that there are 5-6 bars. The first one is saline non-stressed. Non-stressed, it just does not makes any difference. It's nothing. You can see stressed animal, CUMS stressed animal, the grooming latency is high, which means for 250 seconds it did not wanted to clean itself. So it is like, let it be, let the water be on me, I am not getting affected. And grooming frequency kitne bar kar raha hai, so the frequency is low. It for a long period of time the stressed animal are not interested, and even when they are interested they are only doing it for 2 times or so. As against to it, fluoxetine. Fluoxetine is a drug that is able to take care of your depression and mood. So fluoxetine will quickly cause the animal to clean itself, almost as good as the normal animals, and the frequency would be also very high. Many times the animal would be cleaning itself. Mark of self-care, mark of self-motivation. As against, you can see this is agmatine 2.5. So agmatine 2.5 is not showing any effect, major effect. Again, for 200 seconds or so, the animal is not interested to clean itself, and the frequency is also less. However, if we can see, agmatine 5 and 10 here are effective. So quickly in 100 seconds, the animal is ready to groom itself and clean itself. Here, maybe less than 100 seconds, and the frequency is also 8 or 9 times the animal would be cleaning itself, and here it would be 12 to 16 के बीच में कहीं पे, मतलब maybe 14 or so. So chronic agmatine and fluoxetine treatment from third week onwards, again from day 15, restored the motivation and self-care behavior. So you can understand that the self-care and the motivational behavior of an individual is very important, which we are correlating with rats in splash test. Now, what is the effect of agmatine in FST? FST is where the immobility time is counted. So this is a marker of despair. Like if the sucrose preference test was a marker of anhedonia is lack of pleasure. Despair is a feeling of worthlessness, which happens in depression. I hope everybody can understand what is worthlessness. It means what is my need in this world or feelings like this. So FST is a typical marker of despair. What do we do in this? We put the animal into a plexiglass, see if the animal tries to free itself, come out of the cylinder, but after a point the animal just gives up. This test is done for 6 minutes. Now here you can see the normal animal would be immobile for 150 plus seconds. Immobility is a marker of despair. They are not trying to come out of the glass. As against the stressed animals, 5 minutes is 300 seconds. So the stressed animal would be around 4.5 minutes, not at all interested in coming out. It is with the feeling of let it be. What is the point? The feeling of despair. Fluoxetine, again a known antidepressant, is bringing that time down, more down than the normal. Agmatine 2.5 unable to deal with the situation, but 5 and 10 showing significant effect and working as antidepressant, where the animal is immobile only for 160 seconds or so and trying. So this is a marker that at least the animal is trying and it is not in despair or in the feeling of worthlessness. Now, effect of agmatine on percent body weight change. We have also counted the body weight daily of the animal. So if you have to diagnose somebody as depressed, body weight is an important criteria. There should be either plus or minus body weight 10% in 1 month or so. So you can see, I'll go again on these graphs. The non-stressed animal is the dotted line. So the non-stressed animal here is above zero. It is gaining weight constantly. That gain is very small, but it is gaining weight. As against the stressed animal, as you can see, is going down on the 14th day severely from day 0 to 14, which means it is losing weight. It is further losing weight on the 21st day, and on the 28th day, it is gaining weight compared to the 21 day. Now this here that we are talking of is adaptation. So if you are into stress for a long period of time, slowly you start adapting to that situation. Okay. Now fluoxetine, let us see how fluoxetine is dealing with this. Fluoxetine is the triangle that we are following. So fluoxetine also on the 14th day has caused increase in weight, 21st again increase in weight, and maybe 28th there is a mild fall, but these all are not significant. So it can be practical error, or it is something, it is small changes, not significant changes. So overall fluoxetine not letting body weight fall and keeping it intact. As against to it, agmatine 2.5 is a triangle that we are following. It is causing decrease in the body weight, fluoxetine, and agmatine 10, 5 and 10 mg. You can see that there are areas that are coming close to this baseline, 0 के पास है circle or unfilled triangle 5 and 10. So it is not allowing the body weight to let fall and maintaining the body weight. However, there is no significant change in the body weight. There is ऐसा बहुत ज़्यादा significant change कुछ नहीं है. Whatever change is less than 5%. Now this is important. Why? Because many antidepressants are known to cause body weight gain. Antidepressant, antipsychotics. So for obvious reasons, depressed patients, schizophrenic patients would not be taking these drugs, because if they take these drugs, they would be obese or their body would be increasing. So our drug of investigation here, agmatine, has an additional advantage that it is not even causing body weight changes. So I take it for depression, stress induced depression, but even after doing that, it will not cause a body weight change. So I will like that drug because it is not changing my appearance. Now, what happens to the plasma corticosterone levels? As I am telling you, this all is about HPA axis, hypothalamus giving signal to the pituitary, giving signal to the adrenal glands. releasing corticosteroids and glucocorticoids and mineralocorticoids. So corticosterone levels in mice are increased in the CUMS stressed animals would be showing a high level of corticosterone. Fluoxetine would be not showing so high, it would be bringing it back to normal, more than normal. 2.5 not effective, 5 and 10 effective. In fact, 10 very effective and close to the normal. So your HPA axis that is dysregulated would be back into place. There would be no dysregulation, and overall there would be no hormonal change or hormonal dysregulation that we are talking of. Okay. So in the final discussion and conclusion, the antidepressant like effect of Agmatine was compared to SSRI fluoxetine, with only difference that Agmatine has shown delayed onset. If you can see sucrose preference, this was our sucrose preference. Yes, here fluoxetine is effective right from the 14th day or 21st day, but Agmatine is effective. Yes, fluoxetine here is effective here only, but Agmatine is slightly late effective. Now this might be because of low doses of Agmatine that we have used, or different mechanism of action. We don't know. So the only problem right now, it has shown slightly delayed onset, but it is showing effect. Although Agmatine has exhibited delayed onset of action, it did not induce significant changes in the body weight. So that is our plus point, that fluoxetine or other drugs are known to cause body weight gain, but Agmatine is not causing any significant changes in body weight. So a person would want to take Agmatine. And unlike other depressant, it did not affect the locomotor count also. This is given as a supplementary data in the paper, if you have seen it. पेपर अगर आपने देखा होगा एंड तक, तो सप्लीमेंट्री डेटा में लोकोमोटर काउंट दिया है हमने. So animals antidepressants would be also affecting your walking motor activity, but Agmatine does not do that. And thus agmatinergic modulation may offer several advantages and may be useful in combination with other depression in the treatment of resistant depressions. So what is resistant depression is where no known normal drugs act, and regular drugs that are into practice or that are into clinical zone are ineffective. So in such a situation, Agmatine would work wonders probably, because it has this unique mechanism of action that is still unexplored, but it may be useful because there we need new drugs. So to conclude, the results of present study demonstrate antidepressant-like effects of Agmatine in chronic unpredictable mild stress induced depression in mice. So thank you, and now I am, with the permission of sir, I am open to queries if there are any.